Hello, this video is going to show you how to do an evaluation or your first visit in Meditech for patients that are switching over. The first step in performing any visit, including evaluations, would be to confirm the visit on the Confirm My Day task. So you click on the day that you did the evaluation and click Begin. The Confirm My Day task will appear, and this is the same as any other visit. So will you be able to perform this visit? Yes. Did you contact this patient? Yes. This visit is authorized. That's why the yes is already blanked out. But if it happened not to be, you would have to pick yes or no and then write a billing note. But in this case, the visit is already authorized. Start time and end time here are not necessary because this is just your scheduled time. You will document your actual time in the Perform Visit task. So I hit Finish, and this task will go away, and it will be replaced by a Perform Visit. This is the evaluation visit for this patient. For demonstration purposes, I'll be demonstrating a PT evaluation, but I'll really be focusing on the actual operation. So you click Begin on the Perform Visit task, and then the Perform Visit task will open up. You'll know you're in the Perform Visit task by the Perform Visit icon listed up here. Perform Visit starts with the patient overview. So just as a review, this is a patient's face sheet. You can see your patient certification period. Diagnoses are listed on the second tab, and the Resources tab lists all the clinicians that are providing services to the patient's physician, as well as the principal program of the patient, the care coordinator, which is your case placer, and your scheduler. There's nothing to do on the patient overview. It's just for view purposes only. So now you can click on Start Visit, or to navigate, you can click Next. It doesn't matter which option you choose. So this pop-up comes up whenever you're documenting after the fact. It warns you that the visit time that populated automatically is always today, and it warns you that today is outside of the ordered range. So you can just close this pop-up, and now you're going to change the time. For demonstration purposes, I am doing this on the 20th. If for any reason you forget which date that you were documenting for, over here in this section, it says notes for 6/20. You can just use this as a reminder that this is the date that you're documenting for. So I'm going to click 6/20. Now, as for time, just a reminder, this is military time. So if you did your visit at 6 p.m., it would be 1800. If you're not sure on how to do that or to avoid mistakes, you can just backspace out the time and type in 600p, hit the Enter key on your keyboard, and it will translate that into military time for you. Over here in the minutes, you can select minutes. They're in 5-minute increments, or if you started your visit at 6:02, you can type 6:02p and hit Enter, and you can document your exact time. Once your time and date are correct, you click OK. In live, very frequently, you'll get a pop-up at this time asking you, are you done performing this visit? Always answer no, because you have not finished your documentation, so technically you are not done. You are not done with the Perform Visit task. So that you want to stay on the Start Visit page and put in your end time. I'm going to say that I left this patient's house at 7 o'clock on the 20th. Once that's there, you just click OK. The last thing you have to do on this page is indicate how you verified this visit. So you click the drop down, and if you use the mobile app, the HHA Exchange app, you would click that. Telephony is if you use the patient's phone to dial in and out and to do your clock in, or you can get a patient's signature capture. We'll be demonstrating this in a separate video. And paper voucher is if you had a paper voucher signed. In code and out code are not required. You should never change the patient status and there's no need to put in any notes over here. So once your start time, end time, and EVV information is filled out, you can come down here and click Next, or you can click the Document Visit icon at the top. Document Visit is where you're going to do all of your visit documentation. So you can scroll up to the top. This area on this side of the screen we refer to as the tree. There's different branches of the tree. So there's routine care steps. This tree happens to have an evaluation because it's the first visit that this service has performed. So to navigate through the tree, you just click on the black line. These are called care steps. Anything that's a black line is referred to as a care step. So this is the Pain Overview Assessment care step. For evaluations, you want to start at the top, and we're going to work all the way down to establish short-term goals. The first thing we need to document is our pain assessment is a DOH regulation. So if your patient did not have pain, you can check the pain control experiences were assessed and there was no significant findings. There was no pain. The second thing you have to do is indicate which pain scale you used to assess the pain. So if you use the FLAC, you can just come here and choose that the FLAC was performed. If you use smiling faces, there's no button for that, so you would just have to manually type in smiling faces. If your patient did have pain, however, this is an example of how you would document details in an overview assessment. An overview assessment is one large topic with different subtopics. And this overview, the main topic is pain, and then the subtopics are pain, pain control, adverse effects, expectations, and the FLAC. If your patient had pain, you would indicate that here on the overview. But in order to say more about that pain, you would want to click the Go To link. This will take you to a separate page where you can document more details about the pain. So when you're on an Assess care step, this gives you a way to assess in greater detail more about that topic. So here I can say, I'll pretend my patient just had scoliosis surgery, so I'm going to say that he had back pain. Area would be right and left. A description, aching, burning. Once you put up here, this arrow here is called a dependency arrow. So once I hit enter, everything that I document here is referring to this line. So if your patient had pain in more than one location, you could fill in the details for each specific location. Now over here is a details section. So you can fill out as much or as little as you need to clinically. So here I would come in and put the pain scale that I used. So I used the smiling faces, 0 to 10, and he had a pain scale of 5. Now you could come in and indicate what issues were aggravating, which factors relieve the pain. You can put in the severity of the pain, the character. So you have a wide variety of options here. You could also supplement those options with a narrative note if either the drop downs don't meet your needs or it's just easier for you to write a detailed narrative than it would be to click on 10 different drop downs. What really matters is that the clinical information that we need for documentation is contained. So you can use the drop downs or you can click a note. Now this applies to all of the assess care steps. So I'm using pain here as a demonstration. Once I am finished documenting everything that I need to about this pain, in order to get back to the overview that I had jumped out of, I can click this Return to Overview button and it returns me to that pain overview assessment. The go-to that I documented, you won't see it up here, but it will be all the way at the bottom under additional documentation. So any go-to that you click and then you document on will fall down below in the additional documentation area of the tree. So now to go to the next care step in the tree, you have two options. You can either just click on the next care step in the tree, or you can click these little down arrows and that will navigate. You can go either way. So perform skin assessment is next. This is another really important care step that we want documented on every visit. So here there's nothing written. So whenever you see a details button, you would come into the first line and click the drop down. Now we have already pre-populated some different choices that you can identify. So here we could say that no skin issues were reported or identified, the patient has an active wound, whatever makes sense. Anytime there's a detail, you can always free text in. So if I wanted to say scar from surgery is healing well, no discharge noted, I can just click OK. It will grab that into the drop down and then hit OK one more time. Now, whenever you're on a care step that has this details button, you're going to get a pop-up afterwards where you can document more details. This information is not required at this time. It's optional. However, if you wanted to say more, you could always do that in the notes section. So I recommend that when you get this pop-up, just come down here to save that detail that you had put down over here. You can document more specific notes down below. Anything that you write in a detail box, however, can be used on future visits in the copy prior instance. We'll demonstrate this in more detail when we go through the routine visit video. Report response to treatment. You can use this to document how the patient responded to the treatment that you provided. So you can, if this is a real evaluation, you really don't have, you don't performing a lot of treatment, but you could come in and say, that the patient required a lot of queuing. If this is a visit, again, just hit save. If this is a visit where you've seen the patient before and you're familiar with the patient, if this is an evaluation because of a missed recertification visit, or if this is an interim assessment, if you don't have goals and interventions established for the patient just yet in the care plan, you could come down here and write a narrative note detailing what you did during the treatment and how the patient responded to that. So this is a very useful care step in which you can document how the patient responded to the treatment in general, and then if your intervention care steps are not on your care plan yet, as it is in this case, you can document a narrative note in this section. For evaluations, we should be teaching therapeutic exercise home program. So you can again click in the box, hit the drop down, and you can indicate that you taught the patient a new exercise and you reviewed technique, frequency, repetition, purposes. You can also say that you reviewed precautions and home environment modifications. So you can choose multiple items in the drop down. You click OK. This is going to save all of them. And then you could document the specific details about what you taught the patient down below in the notes section. This care step is regarding education outcome. How did the patient and family respond to your education? So you could say that the caregiver verbalized understanding. The patient may require reinforcement. Again, the free text option is here on all details if you wanted to say something, and that would be available for you to pick on your drop downs when you click copy prior instance on routine visits. Again, just hit save. There's the supervised aid services. I'll go over that in greater detail in another video regarding home health aid supervision. The next care step on the routine section of the tree is assess vital signs. Now this one looks a little bit different because it defaults to the care step details page. This page gives you some policy and procedure text so you can read it Vital signs required for every nursing visit and strongly recommended yet optional for rehab. If you don't want it to default to this in the future, you can click Read, that you've read this policy and procedure text. To get to the screen where you can enter your vital signs, you'll click on the first tab that says Assess Vital Signs. This is where you can enter in vital signs if you have recorded them. So you could click the drop down, put in the temperature, 98.6. Okay. Pulse, respirations, same thing. You can put in 18. Okay. Blood pressure is here as well. Now, one other interesting thing about the Assess Vital Signs tab, all of the care steps have this, but vital signs, this is extremely useful, is you can come here and click the History tab. History tab, you can view days, weeks, or months. Now here, if you see the dot, if you click on the dot, it'll tell you on 6/17 his temperature was 99. On 6/17, respirations were 12. So over time, as you start using this system more and more, anytime anyone documents a vital signs, it plots that date on the graph. So you can get a visual cue of what the norms are for this patient. To navigate back, just close that and hit Assess Vital Signs. Now the last two care steps that are in the routine care step part of the tree, assess equipment and establish short-term goals, are also part of the evaluation. The reason they appear twice is because we want these care steps to be available to you on every visit, and that is why they are part of the routine care steps. However, whatever you document in here, if it's duplicated in the tree, whatever you write up here will also appear down here. So it's completely up to you if you'd like to document them here or down here. But what I'm going to do is I'm going to focus on the evaluation part of the assessment right now, and we'll see those care steps as we get through the evaluation. So now, the first care step in all of the evaluations, regardless of what discipline it is medical history overview. Now, this is very important because generally, if they are been admitted to our certified home health care agency, they do have a significant medical history. So you will not be clicking up here on this overview. You will be coming here to significant medical history. Now, again, this would be an important go-to because this is where you would document the patient's medical history. Last physician appointment, that is not necessary for rehab. However, condition, we have a drop down of all of the commonly come across diagnoses. Again, there is a free text option, so you can type in whatever else that you might need, depending if it's not here on the list. So I'm just going to say that my patient has cerebral palsy. He's got a seizure disorder, and he just had scoliosis, so he has a scoliosis diagnosis. Click OK. The usual diet, average weight, that might be important, especially if you're a speech therapist or if your patient does have dietary issues. Past hospitalizations, so if they have been in the hospital recently, I would say in the last year or two, I would include it. Now the date is a free text option, so you can say here, scoliosis surgery. And even if you don't know the exact date, you can just put January 2016. Past therapy history, you can put an accounting of how and where he has gotten therapy in the past. You can focus just on your discipline. So once you click your discipline, here's one of those dependency arrows again. So once you choose PT, you can say that they're receiving school-based, outpatient services from a day hab program, or if they're receiving services from home care. Again, here's a free text. So I'm going to say this patient receives therapy twice a week at school. Now it says weeks of treatment. However, you can put in how many times a week. You can also come down here. Another useful part of the system is the ability to read other people's documentation. So if you know that the nurse did a thorough medical history evaluation, if you come, it's right here on the medical history go-to, on the assess medical history. However, attachments are also available up here at any point in time if you'd like to go and read somebody else's note. So I'm going to use the one that's here. So I'm going to click attachments. When you click the attachments link, either at the top or down there here, you can come and say, I would like to see that skilled nursing admission note. So I wouldn't put link, I would just hit view. So now this opens a preview of that nurse's note. So if you wanted to come into the nurse's note and review the medical history that the nurse had written, it's easy and convenient for you. So you can just hit cancel. And now you can even come down here and say, reviewed medical history as per Harmon assessment and in agreement with findings. Basically not having to rewrite the entire medical history, but making sure that you're completely aware of everything. You can also add any other medical history that you found during your parent interview. So to get back to the medical history overview assessment, we will click the return to overview, and it brings you back. Now you can come in and talk about allergies, family history, surgical history. So if the patient just had scoliosis surgery, you can again click that, hit the go-to, type of surgery, date, and then you can put a little note in if you wanted to put more information. And now hit return to overview. Abuse and neglect, you can say that there's no history. Now, certain things may or may not apply to your patient. Most of our pediatric patients, military service history does not apply. If the detail does not apply to your patient, you don't have to say yes or no. You can just skip that section. So a good example of that is the newborn overview. My patient is 16 years old. The newborn overview, again, this defaults to the care step details, so it gives you some instructions. Newborn overview must be completed on children who are less than 3. So the newborn overview, none of this applies. So we're just not going to document on it at all. You can just skip it. If you don't document anything, it will not appear on the PDF printout of the note. So other common evaluation areas are your environment overview. So you would want to come in. Hopefully, your patient does not have any environmental problems. However, lots of our patients experience barriers which limit their mobility. Even if you're not particularly working on it, it's always good to come in and identify what the barriers are. So if the insurance ever says this patient should go to outpatient, it would be nice if you had documented that the patient's house is inaccessible. They can't get into their front, their entries because there's stairs, any other contributing factors. They're completely dependent on others. So it's always good to identify if there's any issues, even if it doesn't directly impact your plan of care. And you can come in and just say that everything was fine. If things are not fine and you're saying that there's a problem, you should definitely go to the go-to, explain more in detail, and obviously let your supervisor know so we can put a plan of action in for this patient. Same thing applies for the safety overview. You can say that safety measures and precautions are in place. You don't need to go into the go-to necessarily on this. Anything you see here with these little numbers, 15, 18, that indicates that the answer to this question is going to appear on the patient's 485 on the doctor's orders. Safety, so you can come in and document on these as necessary. The next care step is assess equipment. Now, this one is very important because, as you know, patient's equipment must appear on the 485 or else we're out of compliance with the doctor's orders. So here's your opportunity to identify all the equipment that the patient has that you are responsible for as per your discipline. So if I am the PT, I would be commenting on the patient has a manual wheelchair, the caregiver manages it. Now, once you put it in here, here's that dependency arrow, and here's where you can document more information about that manual chair. So you can use these drop downs as it applies for your patient. So you can come in and say that they're dependent with the wheelchair, their family is using it correctly, they're assisted by the caregiver, their condition, the condition of the equipment. This is very important because a lot of our patients do not have good equipment or they have problems with it. So you can put down if it's safe or not safe. Status indicates if they buy, own, rent. So that you may not know that information. If you don't know it, you can just leave it out. Now, serial number. Although it says serial number, this is a good place to put in the details of the equipment. So we can say this is a tilt in space from MedStar, received in 2012. This is really good information that if you know it, if there's ever any equipment problems down the road, we have it documented here in Meditech and it is viewable by all. So now a lot of this stuff may not apply to a wheelchair. So if it doesn't apply, you don't have to fill it in. So you would want to come in and say, scroll down and say that they have a full support bath chair, DME. You can say this is an otter bath chair. It's safe. And maybe they're using it incorrectly. They're not using the straps, and that could be something that you can document down here. Not using straps on otter. So you would add in all of the equipment that your discipline is responsible for. Now, you may need to put in more than just your discipline, especially if your patient is not receiving OT, PT, and speech. So if you're an occupational therapist and there's no PT on the case, you should also be coming in and indicating that they have orthotics, that maybe they have AFOs. And again, filling in the details as necessary. So that's the assess equipment care step. It is really important because this area up here where it says type is what is going to be put on the 485. So in order for us to be in compliance with the DOH, you want to make sure that everything your patient has is listed here. Now let's say you have more than 3 pieces of equipment. They're all grayed out. To add another line, you just click on one of the details and then click the little green plus sign. And now a new line opens up for documentation. If you realize that you made a mistake and a piece of equipment doesn't belong in here, or just a detail in general, you can click on it and then click the red X, and that will remove that row and any associated details with that. The next general care step is respiratory overview. Now this gives you an overview of your patient's respiratory system. So you can come in. Now this is one where you can say a lot of things in general, saying that they have evidence of altered respiratory, they have poor endurance, periods of apnea, maybe they receive a breathing treatment. Now let's say your patient is on a trach. You click the trach. If you go to the go-to, this may have more detail than is really above our pay grade. This looks like more of a nursing thing. So you can return to the overview. So you can say something on the respiratory overview without necessarily having to jump into every single go-to to to say what you need to say about your patient. So this might be a good care step to come down and do a narrative note explaining the details of your patient's respiratory problems as it pertains to your particular care plan. Rather than clicking, 10 go-tos to say one thing, you can say those 10 things in one narrative note at the bottom of the overview. There's a neurological overview. Again, same thing. You click on the issues that your patients have. So if your patient has motor perceptual deficits, visual perceptual deficits, they have seizures, and you can click into the go-tos and document more details about those issues. And again, you don't have to fill in everything. You can come in and say one thing, she had a seizure last month. And then you can always, if the details don't match what you want to say, you can always write a narrative note. Turn to the overview. Or you can write a note about this child's neurologic issues in general down here in the notes section. There's musculoskeletal. Now we're getting into the more of the discipline specific. So this happens to be a physical therapy evaluation. So once you get down past the neurologic, this is where it breaks out more into the specific disciplines. So PT has musculoskeletal mobility, assessing transfers. OT has the same ones, but they also include the ADLs and the IADL care step overviews and assess care steps. Speech will have their language, oral motor, and those care steps. So I'm not going to go into the details of the discipline specific ones for this general overview, but the operation is the same. You come in, you click the assess. If you have more details to say, you click the go to or write a narrative note. So now there's the cognitive overview. So this gives a general sense of how the child's cognitive function is. Even though your discipline might not be working specifically on the cognitive, it's very important that we account for how the patient's cognition affects the child's ability or the patient's ability to learn. So that way, when managed care only gives us 8 visits, we can say it's going to take us a longer time to teach this patient something because they have cognitive delays. So you can come in and say that they're aware, they're oriented, but maybe they have some memory problems, some judgment and insight problems. And also you would want to come in and put a specific note about what your child's cognitive and mental functioning is about. You can also click the go-tos. Again, these go-tos will trigger, means that there is something on the 485 that this will come in and pull into the 485 on. The same concept applies to the assess learning. So you can put in the patient's name, the patient, and their ability, willingness, and barriers to their learning styles. The patient has limited ability, unknown if the child's low functioning, and the barriers, you can say that they have, poor attention span, speech limitations, cognitive limits. Again, setting the stage of how this patient learns and how this will affect the patient's ability to participate in the plan of care. Now, the last 5 care steps kind of work as the summary care steps. So the first care steps, again, this is a PT example, but the general function still is the same. Once you click on here, you click in the details. And what we've done is created a list of deficits that are generally present in patients that are referred for or receiving your discipline. So depending on the function of your patient, you would come in and check off anything that applies. Now, this doesn't necessarily mean that you're going to be focusing on this in your plan of care. It's just giving a general sense of how this patient is functioning and all the different issues. If it isn't lying, you can include it because we want the managed care companies to see just how impaired and complex our patients are, so they will keep approving services. So you can check everything that applies and click OK. Again, you can hit save. And here we definitely want you to write a narrative note giving more details about your patient's problems. Now you can do that here in the notes section, or you can come here when you're done selecting, hit the plus sign, and free text in right lower extremity weakness, more specific, and put drop. So that way, when you have to write your 60-day summaries or your managed care summaries, whatever you write here in this detail will be available for copying on future summaries. Okay. And then save. And then a narrative note giving a little bit more detail. The next care step is your justification for home care services. Why does this patient need home care versus services from another location, such as school or outpatient? The insurance companies want to know this because they think that other services are cheaper and they would rather pay for those. So it's up to us to indicate why they need services at home. So they'll deteriorate without skilled intervention. They require training in the home environment for maximal learning and carryover. There's specific home-based issues. Maybe the patient isn't homebound, but they are medically fragile. They need max assist for transfers and transportation. And maybe they don't have accessible transportation, so it's not easy for them to put the child in a car and take them to outpatient. It's difficult and taxing to have them leave the house. And for our patients that are of school age, school-based services specifically focus on educational goals. They are not working on home-based medical issues. So we can say, even though the child receives services at school, this is why they need the services at home. Again, there's a free text option in case you ever needed to put anything specific in there. Hit save. And now, this is your justification. It's almost like your letter of medical necessity. It's called Update Justification. Therapy services are medically necessary to address. It's a very similar list to that first one of the PT primary deficit. So why are services medically necessary? You can always come in and check all and uncheck the one or two that may or not apply, depending on how complex your patient is. Maybe they don't have respiratory issues. You could click OK and hit save. And again, you can add any specific notes down here, or you can come up here, add another line, and put in a free text option. Report frequency recommendations. So here's that policy and procedure text again. So you can just read that, click read, and then come back here to that first line. And we're going to want to recommend our frequency. Now, the reason we have this here, we don't want you to free text here because we want you to pick one of these options. We never want to recommend a range. So if you're recommending twice a week, put down twice a week. Click OK. And short-term goals. Now, short-term goals is the one time that you're not necessarily going to pick from the details. What you're going to do is you're just going to type in those short-term goals, those measurable functional targets that you want this patient to achieve. Generally, the time frame for the goals will be 2 months for the certification period. However, if your patient is action level 1, red, the insurance companies going to want to see progress towards goals every 2, 3, or 4 weeks. So you want to make sure that your goals are small enough to make sure that they're achievable. So you can put down a short-term goal. Patient will be able to maintain head control in line for 5 seconds with min assist. Because now that goal, in 2 weeks, you can say, come back and say that this goal was met, and up the goal to 10 seconds. So your short-term goals are flexible. They're available to you on every visit in the routine care steps section. So we want to see changes relatively frequently. That is why it's here on the routine care steps, because on future visits, you can copy prior instance, pull this goal into your note, and then comment on the progress towards it. This is very important and probably the most important care step when it comes to being able to keep our patients on service. We want to be able to show that therapy is effectively meeting this patient's goals. So once you get down to the established short-term goals section of your note, when you scroll down, the next section is called the plan. So this refers to the care plan, the goals and interventions that are currently on file for the patient. Now, when you first go in for your first visit, you haven't entered in your long-term goals yet. You're going to do that in the next task. That task is called Contribute to Service Plan. So you establish your short-term goals here in the documentation, and in the next task, you'll put in your goals and interventions. So right now, these are only skilled nursing goals, so we're not going to chart on those. So we are done with the documentation section, documentation page. Now, a lot of people are very tempted to click finish at this point, but you're not finished. So what you're going to do is you're going to click next. So the next page is your clinical profile page. This is just a read-only display of the patient's allergies, advanced directives, and emergency priorities. It's for viewing purposes only. If you click next, you'll see their medication profile. So this is a list of all the active medications that the patient is on. If you'd like to learn more about your patient's medication, you can click here in the Med Ed column, click English, and then the medication education sheet will appear with how to use it, side effects, precautions. So it's the same thing that you get from CVS whenever you pick up a prescription. It's good to learn some more about the patient's medications. Then you can click next. Lab results, again, this is just for information purposes only. And the next tab is called Communications. This is the Communications page. This page is part of every Perform visit. It easily lets you communicate with the nurse within the task itself without having to send a separate email or a secure text. So when you're doing an evaluation, you should always, when you're finished documenting on this page, come in and send a coordination. You want to coordinate with the nurse as well as all of the other therapists on the team to give an update on your findings and your recommendations. The best way to do this is to choose the method called team communication. What this does is it will send a communication to everyone on the team on their task list to receive your communication, so they'll have to read what you wrote. Generate task, you can skip. End time, you can skip. We do want this to include it on the visit note, so you can leave that checked. And now when you click the send to, this is who you want to receive. So we have a shortcut built into the system. If you choose all team leads, everyone on the team who's the lead clinician, so that's the lead nurse, OT, PT, speech, nutrition, social work, will receive this on their home screen after they synchronize or when they log in through Citrix. If you want to include another additional person, say your team supervisor, you can put their name directly in. The easiest way to put people's names is to type the last 4 letters of their last name. So I'm going to send it to myself just for demonstration purposes so I can show you what it looks like when you receive it. So I'll type in the first 4 letters of my name and hit enter, and it picks up my name. So now you'll put in your communication. So basically you can just type what you would leave on a voicemail to everyone on the team indicating. So patient evaluated today, recommending 2 times a week frequency. Sorry about the spelling. To focus on improving motion, strength, and standing balance. Now, one thing the system does not have a spell check, so I strongly recommend you read over what you write and make the necessary corrections right here. Hopefully that will be coming out in future versions. This is just a shorter communication just for demonstration purposes. However, you can definitely expand upon this. Think of it as letting everyone else on the team know what your findings are, what your recommendations are, and what you plan on working with. So now, once you're finished with this, you can click Next. So now when you are on the complete visit page, you can't click Next anymore. So you know this is it. This is the last page of the task. So very important, you want to look at the visit type. So this was actually a PT evaluation. So I'm going to change my PT back to an eval. You can ignore planned time. What you do want to focus on is your start and end time. This is where you're going to make sure that your time is accurate, because this is your last opportunity to make sure that your time and date is correct. This is your electronic visit verification. So once this section is complete and accurate, then you'll come down here to things to consider. Were you able to perform this visit? Yes. Now, complete documentation later. If you are finished with your documentation, you can leave this blank. The only time that you would want to come into this is if you needed to come back to this task later and finish your notes. So if you did that, if you come in and say yes, the apply signature button is no longer available. It means that your note is not complete. It is not finished. It also will not pull into, the payroll system. So the only time you want to do this is if you're truly wanting to finish the documentation at a later date. Otherwise, you can leave it blank. The second line says primary payer's affinity. Has this changed? We should be checking with our patients to ensure that their insurance information is still correct. So if your parents report to you that their child has new health insurance, you would come in and say yes. And when you do that, a billing note becomes required. So you would have to write mother reports, patient now has Blue Cross. And then you would save the note. So this is how you could notify the office if their patient reports having new insurance. Otherwise, if the insurance is the same, you can just leave it blank. Admit to therapy services. If your patient is going to be getting ongoing services, you would say yes. The only time you would say no to this is if you did the eval and the patient did not qualify or does not need your services. Request visit note to be printed and initiate discharge. You can just leave blank. Even if you are discharging, if you say yes to this question, this is referring to agency discharges. Only nursing and supervisors should be discharging patients. Rehab is not involved. If you see the question, has the patient died at home? That means you did something wrong. So you're going to come back in here, backspace or say no. We want to leave that section blank. So now you're going to apply your signature. Before you click the finish button, you want to ask yourself two questions. Is my time and dates correct? And did I finish my documentation? If you wanted to do a quick look back to check out your documentation before you leave this task, you can click these double arrows up here just to move the pages back and then go back to the document visit. This will bring you back to the tree so you can review. So everything that's got either a plus or a minus sign in front of it means that you touched it. If there's nothing in front of it, like the newborn assessment, it means you did not document on it. So that's how you can just quick check within the task, did you document your visit? So you can now click the double arrows forward to get back to the complete visit page. You can also navigate using the previous and the next buttons. So again, just to reiterate, before you click finish, you want to be on the complete visit page. Make sure your visit type, start and end type are correct, and that you've signed everything here. So once you click finish, you're going to get an integrity check. The integrity check says, evaluation complete, please select yes or no. Just click correct, and it brings you back. On the first line of the evaluation, there's a question saying, is the evaluation complete? Most of the time, you're going to forget to come back up from short-term goals, come up to the eval to say yes, so just let the integrity check catch it. And then if you're done with the evaluation, you click yes. If you click no or leave it blank, the evaluation will keep appearing on future notes. So if you're done with the eval, you want to make sure that you say yes. So now you can hit finish one more time, and there's no more integrity checks. So it'll just bring you right back to your home screen. So the perform visit task will be finished. And now 2 new tasks are going to appear on your task list. The 2 new tasks that generated were contribute to service plan 1, physical therapy. This is your care planning task. This is where you're going to establish your long-term goals and your interventions for the patient. The second task that generated was that receive team communication. I'll demonstrate this. So if you want to read a team communication, you just click begin. The patient overview is going to be the first page of this task. So then you would just click review communication. And then this is what I wrote during the evaluation. So this is what the nurse and all the other team leads would receive as the communication. So to complete this task, you would just say that you have reviewed this team communication and hit finish. And then it'll disappear from your task list. Contribute to service plan task generates because you said yes to admit to therapy services on the complete visit page of the evaluation. I'll be going into more detail about this task in a separate video. Once you complete any perform visit task, you're going to get a pop-up that says visit note. What would you like to do with this document? We strongly recommend that you click preview and hit OK. And this is where you can come in and take a look at the note that you generated on the document visit page. So this is what the evaluation looks like. Now, this one is 4 pages long because I did not put that much clinical information and I did not document on all the discipline specific. Now, we strongly recommend in the beginning that you read this in its entirety and make sure that you didn't miss anything. I will be going into how to make corrections to completed documentation in a separate video. The task for that is called View Revised Documentation. Just as a quick tip, if you want to increase the font size and the view of any of these pop-up PDF previews, click F8 on your keyboard, and then the menu opens up. So then you could change your view to make it look bigger. So then you could see it a little bit better. You could also print this for your own personal records if you're using Citrix at home. So to get rid of this pop-up, you just click the red X to close it, and it'll return you to your home screen. We will be covering the Contribute to Service Plan task in the next video.